It's great to be back again for our next panel, and I hope you keep those questions coming on Slido so that we can continue to have your interactions as part of this next session, which is going to focus on an exciting new topic, I think it is anyway, as we look at the potential for prescription food as medicine and potential Farm Bill and USDA programs. So I'm excited to have with me the International Fresh Produce Association CEO, Cathy Burns. And we're also going to hear from, recently arrived just in time, the CEO of About Fresh, Josh Trautwein, and then the founder of SunTerra, Steve Brazeel. So thank you, all three of you, for being here. And Cathy, I'm going to go ahead and start with you in terms of this year we've seen a lot of action already from the Specialty Crop Farm Bill Alliance. And I think you guys are game on in a very big way this cycle for the Farm Bill. Tell us a little bit about how you brought all these different groups that make up that coalition and why the focus on prescription fresh produce as medicine and the interest in that.
Great. Thank you, Sarah, and thank you to you and your team for having such an important topic on the stage this time around. So yes, the Specialty Crops Farm Bill Alliance is off and running, and we are game on. We have 109 recommendations that we submitted as part of the Farm Bill. That's what happens when you represent the full supply chain, as we do. And why this topic? It doesn't take much to create the burning platform for this particular topic. 80% of our healthcare dollars are spent on chronic preventable diseases. 1 in 10 Americans are eating the recommended amounts of fruits and vegetables each day. That means 90% of Americans are not eating the amount of fruits and vegetables that we should be eating every day. So this topic is hugely important. And if you think about it, 150 million Americans are covered by some type of federal health care system. That's almost half our population. Medicare, Medicaid, VA, Indian Health Services, just to name a few. So if you just took Medicare, and based on our estimates, 30 million people in the Medicare system would be eligible for some type of food as medicine benefit based on them having a diet-related diseases or some type of food insecurity. And if you say, okay, let's give them $40 a month for fruits and vegetables. By the way, that's $1.33 a day. $40 a month. That's an extra $14.5 billion in fruit and vegetable sales, which obviously I'm responsible for advocating for, but it's also great for farmers, great for rural America, as we heard earlier. And the opportunity lies in just that population, but think about if that's scaled across the whole federal healthcare system and private insurers, what that could mean. And produce prescriptions certainly is one entry point into that we're very excited to talk about today. And produce prescriptions is exactly like what it sounds like. You go to your doctor, you have a diagnosis, they give you a prescription for a fruit and vegetable. You take it to a participating retailer, you use the technology you're about to hear, and then you start, obviously that's your dosage that gets covered by either a federal healthcare system or a private insurer, and that's already happening today. We have healthcare organizations, we have our federal government, we can talk a little bit more about scaling and where we get the funding for this in the future, but this could be transformational for the trajectory of human health in this country. So I'm excited to share more about what I think about funding and how we really put this to scale.
Super. Well, as we have discussed, there are over 100 programs already in existence in 38 states, and many of you are familiar with the Gus Schumacher Nutrition Incentive Programs, at GusNIP. We always love our acronyms here in Washington, D.C., even if they don't normally make sense to some people. But This has been going on for a while and perhaps not really as formalized. And Josh, that's why I think your experience of having been in this space for really about a decade now, share with us about Fresh and how you got started and where you are now.
Great to be here. Really important conversation that I have been passionate about for the better part of the decade. My work and our work at About Fresh is really grounded in community-based food activism, with the bend towards thinking about how do we embed food as a permanent feature of care delivery. Cathy did a really great job of teeing up the impact that food has on our healthcare system economically, but more importantly, what centers us is the impact that food insecurity has on our culture, our ability to connect with loved ones just day to day, how we show up at work and how we show up at school. But there is this amazing opportunity to recruit the healthcare sector as an investor in a future state of food access equity. So that's our starting point right there. And very different than some of the newer work that we're doing right now. Our original program is called Fresh Truck. We turn school buses into grocery stores that we operate around Boston as a way of just addressing proximity as a barrier towards healthy food for low-income folks experiencing food insecurity. But we operate a really traditional retail model, right, where we actually buying all of our food wholesale, selling it retail so that we can control that experience, really offer a dignified way for folks to access food while honoring food culture, ensuring our food's fresh day to day. But what we started to hear back, through that very grassroots program was that money was getting in the way of affording all of the food that our shoppers otherwise wanted to be able to buy. At the same time, we had our healthcare partners, mostly community health centers at the time, coming to us and saying, hey, I got, $5,000, $10,000 grant. There's a way for us to cover the cost of food on the truck. So we literally just started off $10, wrote $10 on a piece of paper, printed out a bunch of them, gave them out to nutritionists, social workers that were supporting patients. And patients were able to use those. They were administered in just the way Cathy described. Point of care, you're screening positive for food insecurity, you're able to get a little slip of paper, said $10, Fresh Truck, and we processed that just like a coupon. It was perfect. We used a little square POS system. And that was the starting point of us getting to think about the role of purchasing power as probably the most important lever that we need to address that constitutes whether or not we have access to food. We've talked a lot about food deserts for a long time, and that's a really important dimension of food security. But we could build all the grocery stores, farmers markets, like great e-commerce services that we want to. If folks don't have money in the bank to be able to afford the food that they need to be healthy, we're not really getting to that endpoint of food security. So fast forward now, that program, that food prescription program is evolved into a technology-enabled platform composed of a debit card that can be programmed with spend parameters based on a patient's dietary health profile and integrated with a wide range of retailers from big box stores all the way down to farmers markets and small independents. So really excited to talk today about how it is that our work engaging the healthcare sector to address food can support food economies.
Thank you. And Steve, your experience is a little bit more recent, but you really jumped into this in a big way, starting as your company doing more of a brokerage operation and then going into the food box program during the pandemic and now fully scaling forward. Tell us a little bit about how you're working in this space.
Great, thank you. Yeah, I think it's great to add a little bit of flavor and background as to how we got here. And we're a grower and distributor of specialty crops, fresh fruits and vegetables out of California mainly. And our world got upended when the pandemic hit, and one of the responses was the food box program that came out of USDA that Erica and Joby were talking about earlier. And we were fortunate enough to be chosen as a contractor for that, and that was life-changing for me for a lot of reasons. Mainly, it stabilized our company. It gave us some hope as to what was coming around the corner, gave us a little bit of comfort, but really allowed us to purchase these items from farmers who were in the same position that we were and route those to these communities. And I think the unintended benefit of this program, the most special part, is it forced us in the room with nonprofits, food banks, faith-based organizations, other community groups that we never would have interacted with before. And so as that program began to sunset, the needs in our communities did not. The TFAP program offers a fresh fruit and vegetable box, and we've been lucky enough to win several of those awards and continue packing. But we were also able to craft a program together that allowed for us to attack that farm level food loss and route those items to food banks in need. And just last week, we crossed over 4 million boxes that we've delivered since the pandemic hit, which is about 90 million pounds. So a significant amount of fresh fruits and vegetables. And because of our work in the community and all this community activity we were doing in Orange County, California, where I'm based, and throughout the state, we were approached about being a medically tailored meal provider for a local health agency in Orange County. And medically tailored meals, for folks that aren't familiar with how they're operated now, in my mind, they're the Meals on Wheels, those other types of organizations that do such great work that we've heard of and all familiar with. But I think because of the box program and programs like it that indicated that we have the ability to deliver fresh fruits and vegetables to people's home in a very quick manner, they developed a medically tailored grocery box. So we've been working on that for the last several months, and we're delivering thousands of boxes every single week to members' homes directly through as a benefit of their insurance policy. And so we've had to integrate registered dietitians. We have 5 RDNs on staff. Had no RDNs on staff, as you might imagine, before the pandemic started or any time in my career. We had to figure out how to do final mile delivery like Amazon does. We had to figure out how to specially tailor every single box to every single person's medical health condition. And so those are a lot of the things that we were not prepared for, but because of this ramp up and our ability to work real closely with community partners, we've been able to pull off. And some of the benefits that we've seen in our community are phenomenal. So we're able to do another assessment after 12 weeks with the members we're working with, and we're seeing phenomenal results in terms of improvement in health and reduction in hospitalizations and doctor's visits, and that 80% that Cathy was referring to.
So just to elaborate a little bit more on this, Steve, because I know at one time you said, "Oh, I'm a farmer. We can fix this. So we can solve things."
Right.
But I mean, you were going into some of these entities, and Josh, I'm sure you as well, with not having probably software even developed yet, or systems
Yeah,
developed.
correct. So our systems, we're in the process of developing those now. It's humans, really operating all these things. But when you're trying to do this at scale, there are technology tools that are absolutely imperative and necessary for us to pull this off at scale with results. Because at the end of the day, we need to show that there was an economic result as well as a community betterment result for this to continue. 2 components to that. We all know that it's better for our communities, but if we can point to some sort of financial savings or economic benefit to go along with it, then I really think that brings it home.
Josh, how about you? Who did you start to call? Who do you reach out to when you're trying to build these systems for delivery?
At the outset of COVID? Mm-hmm. Yeah, that was on us. I mean, we've been at this work for a while on the ground, and so the first folks that we called on were our network of community partners. And that was a real stress test for us, just as far as those relationships that we had built up. And I was looking at a picture earlier on today when we had developed a really similar direct-to-doorstep delivery program as to what Steve was describing. And it's hard. Last mile delivery is really, really hard. Even while we ran a retail business, pre-packing boxes, getting them to people's doorsteps. When you think about language barriers, the barriers that come along with, at least in an urban context, entering into public housing, there's no concierge. We don't have box rooms or anything like that. So it takes trust to just get through that door. And we talked to Uber Eats, we talked to Instacart to ask them if they could bring this to scale more quickly, and it was all shoulders, just because of the complexities that come along with last mile, and of course some of the underlying economics. So we looked inwardly at our own systems. Luckily, we had a HIPAA-compliant technology platform pre-built that we could leverage and repurpose. And we leaned on our technology team, got them away from Fresh Connect, and pivoted them towards response work. And then it was really a ground-up build of technology, and then just delivery operations, the stuff around the edges to ensure that we could support our households. But it was, folks were looking at us, so we couldn't look very far beyond ourselves and our partners.
What's really exciting about that, Sarah, is you mentioned there are 108 programs across 32 states right now. Oh, by the way, they're working. Blood pressure is going down, weight is going down, BMI results are getting bigger, blood sugar levels are changing. So there's no argument that this works. The issue is scale. And the opportunity, you need to bring policymakers together, retailers together, healthcare professionals together, technology together, and oh, by the way, the user experience. Pretty easy, huh? Collaboration's the new currency. We should be able to do that. And what the unlock that Josh and his team have created is the opportunity, because you can't have 108 different well, we do actually have 108, probably variations of the same program, specifically talking about produce prescriptions. But the unlock is to be able to have the technology so that regardless of what retail establishment you go into, you would have access to your produce prescription based on the recommendation from your healthcare physician. So that's the real exciting part, is the unlock to be able to do that. And again, I know we'll get to funding, but the technology and the user experience is absolutely paramount.
And Sarah, if I could just add one thing to that, I think one of the things, we do have this aspiration of building the technology infrastructure to transact and manage our investments into food as medicine, which is extremely complex within a healthcare environment when we start to think about HIPAA. But one of our core design principles is how do we leverage all of that built up trust and community infrastructure that exists across those 108 programs already and more. And there's a wider constellation of partners. So we really think about Fresh Connect not as the single solution, but more so as the technology backbone to enable scale, building off of all the work that's already happening.
So a question did come in on Slido about technology and whether or not there needs to be different requirements for identity preserved and to really make sure that the right thing, right type of produce is going to the right person at the right time. Do you foresee that that's going to be part of how you deliver in the future with an identity preserved component of everything you do?
To an extent, we're a proponent of inclusion and sort of an expansive, product offering in the provision of food as medicine, really specifically thinking about culture. All the programs that we do are not effective if they're not culturally aligned with the folks that we're attempting to serve. So we really resist tightly restricting how folks go about accessing food. But it is an imperative. It is an imperative. I mean, if we are going to get the healthcare sectors to sustain all of their investments into food as medicine, we need to ensure that those investments are aligned with patient healthcare goals and are driving the desired outcomes. So that's something that's deeply embedded into our platform. We have a great third-party application sifter that y'all can check out that is able to ingest dietary health parameters and then index foods across retailers, large and small, that fit within those parameters. So that's a really exciting progression of our platform that enables us to, I think, balance that value of just inclusion and optionality for our cardholders that use Fresh Connect, while also living up to our covenant to healthcare providers to ensure that the foods that they're investing in are aligned with that patient's healthcare goals.
I know Steve talked about this earlier, dignity and respect, and your boxes, as it relates to medically tailored meals, can be delivered to any of us. And I thought it was really interesting when you were sharing.
That's something that we decided to do very early in the Farmers to Families Food Box program. We wanted to make sure that, we weren't just throwing stuff in a box and sending it to a food bank. And, we were working with local food bank partners and really asking them what they wanted in the box, what was most necessary, what would meet the nutritional goals, what people like to eat, and really give them that experience that you and I would get at the grocery store, and to the point where we branded our box. And so our box looks like you're getting a box from HelloFresh or Blue Apron or one of the others with insulation, ice packs, all that type of stuff. So we're not doing a food rescue program where we're putting number twos, produce that's about to go bad, et cetera. This is all number one produce, and it's really tailored. It's critical that, and you mentioned the culture piece, and we catch that during our registered dietitian assessment. It's critical that we give people food that they're going to eat, right? And that they like to eat, and that they want to prepare. What's the point of providing a box of produce to somebody with items in it that they have no idea what they are? Now, that being said, this gives us a tremendous opportunity to provide some of these items that have been out of reach for a lot of customers. I talked to a lot of growers of asparagus or cauliflower or some of these items that are $6, $7 a piece. That you and I might take for granted that this population does not purchase. But when they get back, when they're in a position to do so, they will if they're provided with that and then shown how to prepare it in various different ways and really provide that educational piece. And then kind of touching on that, and I'm sure you've seen it, Josh, there's a relationship that needs to be built between our organization and the member that we're dealing with. There's a tremendous level of communication going back and forth, and it's critical for us to make sure we're responsive, that we're providing them with something that they enjoy, that's fresh, that they're getting the best experience from, because at the end of the day, those are our customers. And back to the dignity that Cathy was referring to, I mean, it's one of those things that we take a specific pride in, and that's why we put our name on the box.
So Cathy, I want to start with you, and then the rest of you can jump in as well. But we've had these discussions that are emerging as part of the Farm Bill, both your alliance, and then you've seen things from Senator Booker and Senator Marshall talking about the potential to have some different provisions that would continue to accelerate these trends. But we also had the White House Conference on Hunger and Nutrition. Tell us a little bit about how you see the impact of that driving this momentum forward.
Yeah, great question. We need both. As it relates to the Farm Bill, what we really need to protect is the GusNIP funding, because 10% of that GusNIP funding actually goes to produce prescription pilots. So we need the pilots to continue to learn, and we also need to make sure that we're also in clinical trials, clinical settings, so that we can continue to get data. Data is king. So the more data we can get into the system, it will be more inspiring to these healthcare providers to jump on board and ultimately end up funding it. That's about it from the Farm Bill perspective. Believe it or not, we're not one of these people on stage that give more money to the Farm Bill. I have 108 other recommendations I need funding for. But for this topic in particular, the money already exists. Medicare, Medicaid, VA, Indian Health Services, private health care. The opportunity to rechannel that money into an opportunity like produce prescriptions or medically tailored meals, we just need to continue to build up the data to show that this is how we're going to scale this going forward. And again, bringing it all the way back to agriculture, my gosh, the easiest way that we're going to help farmers is to drive sales. The easiest way we're going to grow their prosperity is to ultimately sell more products. And this is a direct link to do this. And oh, by the way, we have the opportunity to change the trajectory of human health. Quite frankly, I think that's worth getting up for in the morning. So from my perspective, the answer is not on the PHARM. It's on the FARM. And that's through programs like these. So I definitely have line of sight to the funding. It's not easy. We need to get all those 5 groups together I just talked about to make it happen, but it is absolutely within line of sight.
I think one thing I wanted to add too, and then when the secretary was here, he was mentioning the Climate Smart Commodities grant program, and we have an organization that we submitted application for, and we're fortunate enough to win a $20 million grant under that program. And part of the pillars of that program for us were utilizing market inefficiencies or attacking farm-level food waste. I really hesitate to call it waste because farmers never leave anything on the field in purpose. It's farm-level food loss. It's product that the market will not accept. If the market would accept it, we'd put it in the box, believe me you. So it's really critical to kind of point out that there are products that just don't meet market standards, but yet meet flavor and nutritional standards. But this critical component of identification and incentivization of farmers to adopt these practices to create more nutrient-dense produce more efficiently and then utilize those to feed all of our communities is really the goal and kind of how it really, the holy grail for me is tying that soil all the way through to somebody's doorstep. And for us to, I love our retail customers in our traditional business. We sell all the major retailers you've heard of. But when you load a truckload of produce and it goes off to retailer A, it kind of goes off into the ether, right? And then for us to be able to deliver and impact somebody and deliver straight to their home and know that the produce that's going in that box is making a meaningful change in somebody's life, it's just a different feeling. And so for that, we're critical. But I thought it was interesting to kind of tie in the Climate Smart Commodities piece and the Project Food Box, which is our food box initiative, is the mission alignment within our grant, and it really was meant to capture some of those items that wouldn't normally make it to the marketplace and get those to people in need.
Well, let's talk about the metrics around success in this. You mentioned food waste. That's reduction of food waste is important. We've also talked about just all the different health metrics, a reduction of blood pressure. What is this over like? If you have a dashboard of the success of prescription produce as medicine, what does that dashboard look like? What does it contain?
I think I can jump in first, and then Josh, you can comment. I know for us, with our particular program, we onboard every prospective member with a full nutritional assessment to really design that box. And then 12 weeks later, a similar assessment needs to be done for that benefit to continue. And so at that 12-week part, which we're just getting to now, we've been doing the program for about 16, 18 weeks, we're starting to see some amazing results. And, you know, obviously we share those in the portal with the healthcare system. So to answer your question, I think that what needs to be shown is the cost savings part and just the general improvement of the community by reducing our impact on the health system. And so there's some very specific metrics that they're looking at. They haven't shared all of them with us, but we do know that as we go through these reauthorization processes, anecdotally from talking to our RDN staff, we're seeing just tremendous results even after a 12-week intervention.
Yeah, and I think for our part, we agree with that endpoint of getting to a place where you know, we can reliably measure changes in health outcomes and cost savings over time. But particularly with produce prescription programs evolving just now, and not just us, from like paper to technology, we still need to define what constitutes like a high quality operational practice to drive engagement. So a lot of what we're thinking about at this point right now is how is it that we just drive spend, right? Like how do we create like an in-store experience, particularly at scale, that like, you know, because we look at, you know, just other types of traditional benefit cards like HSAs and like FSAs, other benefits that are delivered through Medicare Advantage, like the rates of engagement are really low. Like, you know, like I think low double digits is like the industry standard. Like that's not good if we're gonna have you know, an impact through produce prescription programs. I think we first want to deeply understand like what's gonna drive engagement in utilization of funds. And then I think we have a really wide network of healthcare partners that we work with that are investing behind the work that we do for a wide range of reasons that I think measure success in different ways. So what's incumbent on us is to ensure that as efficiently as we can, we're tying, you know, our cardholder level spend data back to electronic health records and third-party research platforms. And, you know, of course, we want to inform that body of research around cost savings and health outcomes, but we want to ensure that that research is grounded in high-quality operational practice. And our platform's a couple years old. So, you know, we have a really wonderful call center team that provides a warm welcome to our program off the top. And we A/B test a lot, different scripts and cadences of like follow-up. And we're really teasing out the data to understand, like, if we welcome someone within 3 days versus in 7 days, what happens? And then what do we do if we notice that somebody isn't shopping? Like, what happens when we intervene there and, like, follow up to say, hey, do you have any questions? And so we're really turning the screws. And I think it's important just not to lose sight that, like, we need to define those elements of operational practice to ensure that we're getting, like, the desired outputs. So that's a lot of what we're thinking about, I guess, in terms of metrics and measurement. We want to get to exactly where Steve is describing, but I think if we're thinking about the staging of those evaluation plans, defining just high-quality operational practices top of mind for us right now.
It's interesting, there's the aspirational target, right? So if we don't change the trajectory of how this next generation is going to eat, it will be the first generation that won't live as long as its parents. So that's worth fighting for in terms of the investment. But there's also, this is a business. You know, you run it like a business. You create shareholder value, you create member value, you create customer value, and you take it down to the individual level. Everything that Josh was just saying you would do when I was running Food Lion, I was looking at customers like that. Trying to understand, how do I continue to create a lifetime of value for this customer? And really put that in perspective. So there's a huge opportunity here to take the metrics that you talk about, whether it's health metrics or shareholder value metrics or sales metrics, all of that. That's what makes it, once again, so solid, is that there's a whole operation behind it that you can measure and talk about the long-term benefits over time. Because at the end of the day, yes, we're creating new habits, and hopefully that person gets off their insulin or other medicines, and then you've turned into a customer for life, especially for our products.
So just across the board, I mean, listening to all this, I'm sure some of you are, and you're asking some of these questions as well about, how do we make this work? How do we get better alignment? How do we overcome some of these challenges? If you had to try to capsulize in one or two words what you see as the biggest challenge to your continued growth in this space, what would it be, Steve?
Ooh, for me, specifically to our situation, is outreach. We go out into the community and perform various different community events, work with community organizations. I spend the vast majority of my time going to different community events, learning about the community, finding the different populations within Orange County that qualify for this benefit as part of their insurance plan. And that education piece, and there's a lot of nuance, as Josh was mentioning too, when you're mentioning your phone staff, and I'm interested to have a conversation with you offline about that. So in Orange County, they require us to be able to communicate in 6 primary languages. So you can understand the difficulty with that. So there's that challenge. It's really operationalizing something that has never existed before. And so my daughter, who doing such a fantastic job on the member success team, she often gets stressed out, and I tried to tell her, we're flying the plane as we're building it, and this is just kind of one of those things that you figure out as you go in a lot of different respects. But there are so many different processes that have never been done before, and I think the other challenge too is there's a constant communication. So the people that we hire have to be empathetic. We hire a lot of people with lived experience that have been part of the Medi-Cal organization. We make sure that people understand that this is, again, there's that trust factor that needs to be built. And then, you're calling somebody and you're asking what their health condition is. I mean, how would you and I react if somebody called and just started asking you these kinds of questions, right? So there's for us, that's kind of the biggest challenge is really humanizing it, making it a dignified process, as Cathy mentioned, and really focusing on providing for our customers, who are the healthcare plans, a really strong product that's going to improve the health of their membership.
And I think for my part, I'd invite everybody to first check out the policy priorities of the National Produce Prescription Collaborative. But I think in order for this movement to be successful over the long term, I would look towards CMS policy to really develop just thoughtful guidance around how food as medicine is provisioned, thinking about billing codes and the allowable use of state-level Medicare and Medicaid dollars. The 1115 waivers have been sort of a tremendous boost to this movement in a fantastic experiment. But new guidance has limited enrollment into produce prescription programs to 6 months, which then makes research really challenging. That being said, CMS, CMMI have been really wonderful thought partners to think about the provisioning of food as medicine, and really just want to continue that work to think about how federal policy cascading to state policy creates a context for the success of the work that we do.
Yeah, so you mentioned the White House conference that happened last fall. There's a couple things that came out of that I think we need to, as a community, act on very quickly. The first is there are 4 states that have leveraged the 1115 Medicaid waivers. So it's California, Massachusetts, Oregon, and North Carolina. So if you live in a state other than those 4, advocate, because they can now get those waivers. As part of the White House conference, they said you can apply for these waivers and you can use them on things like produce prescriptions. So right now, those, the rest of the states can definitely take advantage of that. In addition to that, the VA and the Indian Health Services, thanks to the leadership of Representative Shelley Pingree, has now been awarded or taken the opportunity to do produce prescriptions as well. So there's definitely, it's starting to gel, but we also need to make sure that we're ready to scale in a way that's meaningful, everything that these 2 gentlemen just spoke about. But those are easy ways for us to start to implement this, in addition to protecting the money in the Farm Bill.
A question came in from the audience about whether or not some others in the space might feel that this is a competitive threat to them. For example, the people who do prescribe things other than food as medicine. Are the pharmaceutical firms weighing in as in a good way, bad way, indifferent?
We haven't heard one peep from the pharmaceutical industry, and we even thought that we might be competitive to food banks and to food distribution organizations as we're rolling out this benefit that allows for this delivery to people's homes. But
Put us out of business.
Have found that to be kind of quite the opposite. They've been super excited and wanting to offer additive services and wanting to be of help to their communities. So we haven't seen that. As a matter of fact, we're working with a couple of retailers which kind of is surprising that they're willing to allow us to market to some of the people that utilize their stores. So we've been shocked and pleasantly shocked and surprised by the excitement of virtually anybody that we've spoken to about this that hasn't looked at it as a competitive opportunity.
We've heard from pharma. We got $1.5 million grant from Takeda Oncology. One, because they care a lot about food as medicine and the moral imperative, but also because there's a potential to pair food as medicine with pharmacological treatment to increase efficacy. If we think about like oncology specifically, statin. So yeah, I mean, certainly too, those competitive pressures exist, but I think we all hope for like a world in the future where we're keeping people healthy and not relying on medicine to take care of them after they get sick. And if anybody wants to debate that, we're up for it, and I'll stand behind the work we do for sure.
I would echo that 100%. There's opportunities to collaborate. There's plenty of, I mean, come on, 1 in 10 Americans are eating the right number of fruits and vegetables. The gap is so large. I can't wait till the day that they think we're a competitor.
Very well said. As we wrap up here, with a few minutes left, I'd like each of you to share a little bit more about your vision for the growth of food as medicine, some of the things that we've already talked about, the challenges that you're facing. But what are you most excited about, the opportunities ahead? And as you get out your crystal ball here a little bit, 5-10 years down the line, what is your delivery system and the market going to look like? Steve?
Yeah, I'll start first. Yeah, and I think we've had several discussions today about the different ways that people distribute food, and a lot of people do it through more of a choice model, and other ones are more of a box model like ours is. So I think there'll be some combination thereof. We work with a ton of food banks who say we're only about choice, so we buy bulk stuff and we put it out, and we don't do food boxes. And then about a month later, they came back and said, can you start sending us some food boxes, because those are just so much easier to distribute, and then kind of a combination thereof. We really see what's going on in California as a precursor. There's 58 counties in California. We're only working in one county currently, and planning on working in every county if we can. But as we see this movement really sweeping the nation, we think there's a tremendous opportunity to take some of the learnings of those 4 states that Cathy mentioned, and some of the actual data to come out of that will drive these decisions. I'm sure there are other states that are probably sitting on their hands waiting to see some numbers, like prove it, let's see it. And so I feel that part of our responsibility is to execute on it so darn well and where we're doing it that another state would be crazy to not do it, because they can see that it can be done. So that I see this as being a movement that is going to continue. I really think it's critical that you have a nutritionist piece to it. That's been kind of a changer for us, to really kind of have that third-party person who's suggesting what items need to be in the box. So I think that's critical. And then the getting it operating is always the biggest challenge, but that's what we do in the farming and produce business. So we'll figure that part of it out. But super excited about where we see the momentum going. Every political leader we talk to and community leader we talk to is extremely excited, because it marries both. It's taking our products, and this is what I try to tell all my specialty crop business associates that think I've lost my mind. I said, this is an opportunity. What other industry can you be in that your product is literally being prescribed as natural medicine? And to take that opportunity and spread that can only be good for the industry and for the health of our country in general.
And I think for my part, we're building technology in service of our mission, and I'm super bullish about the potential of what we built up so far, because I think we bring a unique perspective to the development of technology, which, typically lacks empathy just because you're so divorced from like the end user that's like using a debit card for a transaction. And we're also really close, we've always been like really close to the healthcare system, right? Like that was my starting point, like working at a health center, and we've always collaborated really closely. So we have a lot of empathy for the clinical operations and what it takes in that setting to effectively and efficiently administer a food prescription program. So, we talked a lot about evaluation and policy, so I'll talk about product a little bit actually. And what we're building towards, and a big part of our product vision that I'm really excited about, is creating a single entry point for the provision of the full range of food as medicine programs. We've talked about medically tailored food boxes, medically tailored meals, medically tailored food benefit cards, like our initial offering that I described right now. And the reality is, when we think about like user experience and the provisioning of food as medicine, folks need those things at different moments, and all of a sudden they need them very suddenly. If someone has an acute exacerbation of a chronic condition, a food benefit card might not be any good anymore. We might have to get them a prepared meal or a food box like straight away. And so we're really thinking about how we can build Fresh Connect in a way that streamlines how it is that a provider can very quickly titrate the right food as medicine intervention at the right time, and at the same time gain more visibility into how that interplay of those different interventions are making an impact over the long term. So from a product standpoint, just really thinking about innovating deeply in clinical operations and healthcare delivery, and I'm excited about some of the work we're doing on that front.
Great. Cathy, you want to wrap us up?
Yeah, for sure. I mean, I absolutely believe this is transformational. I spent 30 years in grocery retail, and I can actually see now, based on what Steve and Josh have been presenting, that this can come to fruition. And the time is now. I mean, there's no better time in a post-COVID world where people have a really different association between their health and the food they eat. What an unbelievable opportunity, because I believe health really, really, really is at the center of the conversation now. And we can take advantage of that, should take advantage of that, have to take advantage of that to really change the trajectory of human health, especially as it relates to people here in America. Everything the Secretary talked about, the livelihood, the rural farmer, the health of the consumer. I mean, this is an answer to that. So imagine a world where your diagnosis is being treated by what's on your plate, not what's in a pill. That's the world I imagine.
Thank you so much. And please join me in thanking all of our panelists for excellent presentations. So if you could just bear with me 1 second, we're going to watch a video from our gold sponsor, the International Dairy Foods Association, and then I'd like to welcome Spencer Chase back up to the stage.
What inspires us to create, to innovate, to nourish, to connect, to sustain. Inspiration comes from the lessons of the past. It is shaped by the challenges and opportunities of the present. And it flourishes and grows in the future. A future where technology and innovation push the boundaries of our potential. Where supply chains are digital, interconnected without interruption. Where farmers and processors and retailers are guided by a single vision. Where food and medicine are intertwined with health and nutrition. A future where sustainability is within reach. and where people are at the center of everything we do. This is the future we are building together at IDFA. A future where we are united to nourish the world, protect the planet, and inspire generations to come. We are dairy. We are IDFA. Join us today.